Here at the conference, I decided to present some of the work we're doing in hepatocellular cancer. There we've been targeting alpha fetoprotein as a tumor antigen, and we found it has immune modulatory function. So I presented some of our recent data on those immune modulatory effects of alpha fetoprotein. We find that in addition to being a target for T-cell responses, we also find a number of effects on myeloid cells. We cultured myeloid dendritic cells with alpha fetoprotein, both cord blood-derived normal AFP and tumor-derived tumor AFP, and found some very potent inhibitory effects on the functions of myeloid-derived dendritic cells. I suspect that it helps co-opt the immune system in favor of the tumor by suppressing the ability of myeloid dendritic cells to present antigen and to promote anti-tumor immunity. One of the effects we see is potent suppression of metabolism of those dendritic cells, and so that suppresses their ability to activate T cells, hence promoting tumor and suppressing immunity. I think it also suggests that AFP is a potent target that we need to focus on. While it's not a checkpoint, I think it's an immune modulatory molecule that is suppressing immunity, and if we can target it, if we can get rid of the cells that are producing AFP systemically, that it's floating through the serum, if we can stop that effect, then we'll stop a potent immune suppressive effect of the tumor, and that will then enable some of our other efforts at promoting anti-tumor immunity, make those more effective. So we're following several stories in this area. So the metabolism suppression story is one of those. Another one I presented here is potential modulation of lipid antigen presentation molecules, and that may impact NKT cell activation downstream. Another story is chemokine secretion modulation, and we find AFP suppresses chemokine secretion by dendritic cells, and that may impact and reduce their ability to crosstalk with a wide variety of other cells. And then the last short story that I presented that's also unpublished is natural killer cell effects. I thought that natural killer cells might be inhibited secondary to the effects on dendritic cells, but instead we find direct effects of AFP on NK cells. So we're investigating the effect of that. It seems to be a short-term skewing effect of the cytokine production by NK cells, but an overall loss of viability, particularly with tumor AFP. So effects on not just myeloid-derived dendritic cells, but also natural killer cells. Well, I think the last 5 phase 3 studies looking at small molecule inhibitors have failed for hepatocellular cancer. I think we know much more about the immune modulatory effects of not just AFP, but other areas of HCC immunity. So if we can, in this case, perhaps target AFP, and that's more than half of all hepatocellular cancers, turn on this molecule. So if we can focus on AFP as an immune suppressor, in addition to combining other immune modulatory targets, I think we might be able to have a greater impact on hepatocellular cancer.